Hello, my name is Mark Thomas. I'm a practice manager at Chelston Surgery in Torquay, and I'm also chair of the managers group for South Devon and Torquay. For us, introducing video is part and parcel of our armoury for patients. It will transform their appointment with us. For us, this is about making life easier for the clinician, making better choices for patients. We've got quite a few videos on our website. To make it easier and more prominent, we have a link which says patient self-care videos available. We've started texting information to patients, specifically those with a chronic disease, linking the particular content to that with a view to getting them to learn and educate themselves and look after themselves prior to coming for their regular appointments. The diabetic content, for example, means that a lot of the consultations that we have, we can actually get all of that work done before the patient arrives. For us, that's important. We believe that will save time for patients and make their consultation better. Our clinicians believe the videos to be excellent, and that's part of the drive behind getting that information into patients' hands. So the doctors, for them, it's a great resource for them. They've particularly been using things like the inhaler techniques. That for them is a huge area. So I know that was a very quick win. The content is exceptional. And then the nurses, as part of their everyday, they do a lot of the day-to-day annual review and chronic disease management with patients, and the content for them is amazing. We're asking patients as they arrive for their appointment, have they seen the content, what do they think? And again, it means that we can then focus the appointment on them rather than talking about, for example, diabetes, about education, lifestyle, healthy eating and so on. We have used the information with text messages to groups of patients. So flu reminder, we've included the content of that. Diabetics, every diabetic patient due their regular review appointments has received the content. And then smoking reminders, smoking status, and giving them the choices about stopping smoking, which is important. For us, all of that content has been viewed favourably, and we've seen a number of access to the site growing weekly from there. Once it was introduced, we were one of the first practices to get on board and see the benefits. I think for us it's education of patients. We've got sort of a very simple message for us: educate patients, educate clinicians and educate staff. So this for us is part of that process, that we have some fantastic content at our fingertips. We have targets that we have to achieve every year on certain conditions, and it's looking at the video content and saying, okay, if, for example, the area of diabetes, there's 7 or 8 videos that are really, really good for that cohort of patients. We're now giving that content in advance of that appointment. So we're hoping that that will then allow us to tailor those appointments much better. And that will give better job satisfaction to our staff as much as anything else. I think healthcare videos is the future. It's part of our armoury. We believe it's an essential service for patients to see in the hands, and long may it continue.